Okay, so I think the streaming is live. Okay, so you can hear me properly. Just give me a thumbs up if you can hear me. Okay, right. So let us start by talking today's topic. So today we have basically the MCQs which are arranged on the surgical instruments. Okay, so again today there is a bit of lag, so I'll have to wait for a certain amount of time, but that's completely fine. Don't worry about it. Can you just tell me, guys, in the comment section, what is it? Right. So good afternoon, all of you guys. Shahrukh, Raza, and everybody. Good afternoon. Good to have all of you guys here with me. So can you just tell me what is this? What is this instrument? Can you just tell me that? There's a bit of lag again today, but okay. So well, yes, Shahrukh is up with the answer. He's saying that it's Humvee's knife. Okay. Right. Okay. What else? Anybody else? So graft harvest. Okay, right. Very good, guys. So well, yes. Right, good. So what is the answer to this particular question? What is this instrument? This instrument is basically it is definitely a Humvee's knife. So what is it? It is a Humvee's knife. Okay. So this is Humvee's knife. Now, if I ask you what is the use of an instrument, so just the graft harvest doesn't tell me the answer. So please understand, it is used for harvesting the split thickness graft or a partial thickness graft. It is not used for harvesting a full thickness graft. Okay, so yes, that's the actually the correct answer. Praveen has told us that it is a partial thickness graft, that is a Thiar's graft. Very good, guys. So here, this is basically used to harvest the partial thickness graft. Okay, now if I ask you how do we like harvest the full thickness graft? So how do we harvest the full thickness graft? Full thickness graft is harvested by with the help of a scissors or a knife. Okay, so please understand what is a full thickness graft. In that you take the epidermis along with the part of like entire dermis. So you take up a knife or you take up a kind of a scissor. So with the help of a scissor or a knife, you harvest a full thickness graft, that is a wolf graft. But the partial thickness graft, it is harvested with the help of this instrument, which is a Humvee's knife. Now, can you just tell me what is this instrument? Can you tell me, guys, what is this instrument? So I'll just wait for you guys. So understand, guys, I could have given you all the difficult instruments in the world, but those are not required at this moment for you. What is required at this moment is to know the basics of the instruments. Okay, so I've tried to cover the basics of the instruments, and I'll be covering this in multiple parts. This is our first part in which we have covered around let's say 12 instruments, and then we will be talking about other instruments in the other parts. So deliberately I'm not putting up very difficult kind of questions here because those are not needed at this moment for you. So well, yes, now I can see some of you have started to answer very well. Yes, the answer is electric dermatome. So very good. What is the answer? It is in fact an electric dermatome. Now what is this? This is basically the advanced version of taking up a split thickness graft. Now earlier we used to use the Humvee's knife, but nowadays many of the government colleges also have this instrument which is called as an electric dermatome. What is the function of this? The function is again it is used to take up a split thickness graft. Please understand, it is used to take up a split thickness graft. It is not used to take up a full thickness graft, it is used to take up a split thickness graft. I hope you understand this, okay? So yes, this is again an electric dermatome and it is also used to take up a split thickness graft, okay? Good, guys, very good. Now, please understand this, this can be asked to you because this is available in most of the government colleges nowadays, okay? Right, now come to this particular kind of question. So can you tell me what is this instrument? Right, so guys, please answer. What is this instrument? Can you guys tell me what is this instrument? Okay, right. So in this, basically sponge holding forceps. Shahrukh has come with the answer. So Nanda is also saying it is a sponge holding. Very good, guys. Very good, guys. It's very good. Answer is in fact a sponge holding forceps. Okay. So yes, it is a sponge holding forceps. Very good. Now, where do we use it? We use it in the painting of the patient. For example, before the start of the surgery, what we do, we take up this instrument, we catch hold of a kind of a gauze piece between the prongs of it, and then we dip it into the betadine, and then we rub it over the patient in order to kind of paint the patient. Okay, so before starting the surgery, this is usually used to paint the patient. This is pre-operatively. Intraoperatively, where it is used, one surgery which you should know of, so it is used in kind of an open cholecystectomy. So when you are basically dissecting the keloid, you can use this instrument to catch hold of the fundus of the gallbladder. Okay, so this is also used in the open cholecystectomy surgery, can be used. Okay, so it can be used, right? Right. Now, this is again a very important kind of an instrument. Can you tell me what is this? Anybody guys, can you tell me what is this? Okay. BP handle, Bart Parker handle, Bart Parker handle. Very good guys, very good. This is in fact a Bart Parker handle, BP handle, very good. So good that you know the name also, that is a BP handle or a Bart Parker handle, very good. So what is this? This is a BP handle or a Bart Parker handle, that is fine. Okay, now what are the numbers of this handle? So this can be either of the size 3 and 4. Okay, so we have the Bart Parker handle which can be either of the size 3 or 4. Now what is the use of these particular things? So can you tell me what knives can be fitted in the Bart Parker handle number 3? So if I ask you, this is basically, if you look at this image, this is the Bart Parker handle 3, and we also have a Bart Parker handle 4. So the important knives which can be fitted on Bart Parker handle 3, can you tell me guys? Important. This is again an important. Okay, so every handle cannot fit each and every knife. So different sizes of handle can fit different size. Okay, so Praveen is saying that 11 and 15 can be fitted on the 3 number. Okay, so yes, he is absolutely correct. On the Bart Parker handle number 3, we can fix 11 and 15 number of blades. And what about the Bart Parker handle 4? In this, what we can fix? We can fix any blades from, let's say, 20 to 24. Okay, so 20, 21, 22, 23, whatever, we can fix that. Okay, so please understand this. So on what, see, other blades are also there, but what you need to remember are only these 3 blades. So 11, that is a kind of a stab knife, 15, that is a D knife. So both these are fitted on the Bart Parker handle size 3, and 20 to 23, they are fitted on the Bart Parker handle size 4. Okay, so this is what I wanted you to know. Now, can you tell me what is this? Can you identify this particular instrument? It's a very simple instrument. Can you identify this? Anybody guys? Right. So I'm repeating again, I'm only covering the important and the basic kind of instruments. So very good, Anik. The answer is in fact a needle forceps. Okay, so needle holding forceps. Okay, so yes, it was not. Okay, so it is definitely, the answer is in fact a needle holding forceps. Okay, so what do we have? So what do we have is, we have a suture in which there is a thread, and at the end of the thread there is a needle. Okay, so this is basically a needle holding forceps which we use for it. So no brainer, it is used to hold the needle of the suture, that is fine. But important thing which you need to understand is, where do you catch hold of the needle? Because there is a particular point of the needle where you catch hold of it. Okay, so please understand, where do you catch hold of this needle? You catch hold of this needle 1/3 or so, okay, 2/3 from the tip of the needle. Okay, so 2/3 from the tip of the needle and 1/3 from this end. Okay, so you catch hold of the needle. The ideal position where you should hold the needle is between 2/3 and the 1/3. Okay, so please understand this. What is the ideal position to hold the needle? It is between the 2/3 and the 1/3. I hope you understand this. Okay, this is important. Okay, this can be asked to you, right? Okay, can we move on? Right, so let us move on and let us talk about this. Can you tell me what is this instrument, guys? Anybody? Can you guide me on this? What is this instrument? Okay, I'm just waiting for you guys. What is this instrument? So please understand, we just talked about where do you kind of hold it. So why it is important to hold it at a proper position? Otherwise, it will be difficult to pass the suture through a tissue. Okay, so if you don't hold it between like this 2/3 and the 1/3 at the junction of the 2/3 1/3, it will be difficult to pass the needle, and the needle can bend or something like that. So that is the reason why you hold it between 2/3 and 1/3. Now I'm getting a mixed response. Anik is saying DJ stent, then Rupal is saying it is a pigtail catheter, and others there is a basically mixed response between a DJ stent and a pigtail catheter. Please understand, guys, this is a DJ stent. So Anik, you're absolutely correct. Yes, in fact, this is a DJ stent. What do you mean by DJ stent? It is a double J stent. Okay, D stands for double and J stands for J shape. Okay, so this is a DJ stent. Okay, so right. Now please understand, guys, whoever has told me that it is a pigtail catheter, so first and foremost, pigtail catheters are bit larger in size. This is the first difference. And what is the other difference? The pigtail catheter will have this bend. So you are right, the bend is similar, but bend is present only at the one end, okay, because it is a catheter. So the other end needs to be straight, but here there is a bend at both ends. So how you can distinguish it between the pigtail catheter and the double J stent? First, the double J stents are thinner. Second point of differentiation is pigtail catheters have bend only at the one end and they are basically larger. I hope you understand this. Okay, so where do you use this DJ stent? So this is basically used. What is the basic fundamental thing which happens when you put in a DJ stent? So what it does, it decompresses the pelvic calyceal system. So if you have a pelvic calyceal system and you have put in a DJ stent, what will happen? The urine will be passed from the pelvic calyceal system to the urinary bladder, and the pressure inside the pelvic calyceal system will fall. Are you understanding? So this is the basic thing which happens. So if you put in a DJ stent, what it does, it decompresses the pelvic calyceal system. Okay, so yes, you can put it for various indications. It is used for the primary treatment of urinoma. If you have a urinoma and they ask you what is the first line of management, then you do go for the DJ stent. Why? Because it decompresses it and it helps in healing the urinoma. First thing, it can be put in if at all there is an impacted stone in the urine, like ureter. So if there is an impacted stone in the ureter, what will you do? If you put this DJ stent, what will happen? It will again decompress the pelvic calyceal system. So yes, it can be used at various places, but what is the basic fundamental thing? What is it doing is, it is kind of decompressing the pelvic calyceal system. In fact, it is reducing the pressure in the pelvic calyceal system. Now, this instrument which I have given you, this is a bit difficult instrument. Now, some of you are answering it as a harmonic. No, it is not at all a harmonic scalpel. Okay, so please understand, if at all they want to give you a harmonic scalpel, first it will be a plastic body and it will be kind of having kind of a logo of a harmonic. It will have harmonic written on it. Okay, so please don't confused with that. So anybody, guys, it is a scope. Very good, Anik, you have come to the first thing. Yes, definitely it is a scope. Please understand, it is not related to the resectoscope. Okay, it is not a resectoscope. Now you must have heard about it. What is this? This is a lithotrite. Okay, so what is the name of the instrument? It is a lithotrite. Okay, did you understand it now? It is a lithotrite. Okay, so can you tell me, guys, now can you tell me where do you use it? What is the use of this instrument? Can you tell me now? So well, yes, Anik and the one who answered Rohan, you guys have come to the resectoscope kind of a thing. So yes, you were right, it is a kind of a scope. We use it for the urinary bladder. So can you tell me now what is the use of this? Stone breakdown. Very good, guys, very good. So what is that particular procedure known as? The particular procedure is known as cystolitholapexy. Okay, so what is it called? It is called as a cystolitholapexy. So what do you understand by the cystolitholapexy? It is basically called as a stone crushing. So what exactly you do, basically you put this instrument inside the urinary bladder, and then whatever the stone is present, you catch hold of that stone between these two prongs and then you press this. So what happens? This big stone is broken down into small stones, and then this can be flushed out into the urine. So this is what is called as a cystolitholapexy. And what is the indication of doing this? If at all the urinary bladder stone is less than 2 centimeters, you can go for this particular thing. What is the procedure? Cystolitholapexy. What is the name of the instrument? It is called as a lithotrite. It is also called as a stone crushing instrument because it is crushing the stone into small pieces. Okay, so this is a stone crushing instrument or a lithotrite. Please understand this. Okay, now let's move on to the next particular question. What is this, guys? PCNL? No, it is not a PCNL. Okay, right. So I think you are like whoever is answering a PCNL, he is watching a bit previous part of it. So guys, can you tell me what is the answer? So well, Anik is saying it's a Malacot. Okay, it's a catheter. Yes, no brainer. It is a catheter. Yes, it is a Malacot catheter. So what you can basically say is you can completely call it as a Malacot self-retaining catheter. Okay, so it is basically a Malacot. You are absolutely correct, guys. This is basically a Malacot self-retaining catheter. Okay, now if I ask you what is the use of this, so can you tell me what is the use of this? Flower end. Very good. So what happens is, okay, so flower end, wherever there is a flower end, yes, you will that is an indication that is a Malacot. Good. Right, this is how you recognize this particular instrument or a catheter or whatever. Now, what is the use of this? Somebody did tell me that it is a pus drainage. Yes, pus drainage is one of the indications of this to put in a Malacot catheter. Good, but what else can be done? So please understand, if there is an abscess in any part of the body, you can put in a Malacot catheter. You can also put it into the, so you must have heard of a surgery. What surgery you must have heard of? You must have heard of Anderson-Himes pyloroplasty. So in the Anderson-Himes pyloroplasty, you also put in this Malacot catheter, but that is the one which has the tubings on both the ends. Okay, so this lies at the pelvis and this goes into the kidney, this goes into the ureter till the urinary bladder. So this is basically the this can also be used in Anderson-Himes pyloroplasty. Hydrated cyst of the liver for metronidazole wash. Okay, well, not really. We really don't use it in the hydrated cyst of the liver. If at all you are operating the hydrated cyst with the open procedure, again, under the guidance, under the vision, you aspirate the hydrated fluid and you inject this colicidal agent. You cannot just open the hydrated cyst and give a wash. No, you don't. Okay. So it is not basically used for giving a wash. It is basically put in any kind of a cavity wherever there is a pus collection or any fluid collection, and it has to be brought out of the body. These are the places where you use it. Okay, now can you tell me, I want a complete name for this instrument. Can you tell me what is the complete name of this particular, again it's a catheter no doubt, but can you tell me the complete name of this catheter and what is the use of this? So guys, can you please tell me what is the complete name of this catheter? This is a tri-way. Okay, triple lumen, Foley's 3-way. Very good, guys. So it is basically a triple lumen, again self-retaining Foley's catheter. Please understand this. This is also self-retaining. You don't have to take any suture to keep it inside the urinary bladder. This happens because of this bulb. Okay, so bulb which you inflate with the kind of a saline. That is the reason for this. Okay, so what is this? No doubt there is a triple lumen kind of a self-retaining Foley's catheter. What is the use of this? Can anybody tell me what is the indication or a specific use of this particular catheter? Anybody, guys? Used in carcinoma bladder. Okay, why? You're right. It is used in carcinoma bladder. Why it is used in carcinoma bladder? See, understand. Whenever you have hematuria, okay, for BCG immunotherapy. No, guys. It is not used for BCG immunotherapy. No. I'll tell you about the BCG immunotherapy, don't worry, but yeah, very good. So answer is basically to irrigation. Okay, so how do you use it? So this is basically used for bladder irrigation. Okay, so this is used for bladder irrigation. And what is this? This is basically a triple lumen self-retaining Foley's catheter. Okay, so it is a triple lumen self-retaining Foley's catheter. I'll just talk a bit about the post-URP. Very good, guys. So post-URP, again you put in this. Why? Because there is a hematuria and you want to irrigate the bladder. So anywhere where the bladder irrigation is needed, you'll go for this. Somebody answered BCG. Well, it is a bit beyond your scope, but just understand where do you, like, how do you instill a BCG? So what you do, you basically instill the BCG with the help of a normal catheter and then you take it out. Okay, so the BCG has to remain inside the urinary bladder for at least 30 minutes to bring about its action. It is not like you irrigate the BCG from the bladder bladder day in and day out. No, it's not like that. What you do is you instill the diluted BCG inside the urinary bladder and you keep it there for 30 minutes, okay, and then you take it out. So that is why, if you must have read that complete incontinence, that is kind of a contraindication for putting a BCG therapy. Okay, so you can correlate it like that, but yes, that is not a very important point. Somebody just answered it as a BCG, so that's why I said it. Okay, so very good. So what is this? This is basically a suction drain. Yes, to be specific, it is a Romo-Vac. Okay, so it is a negative suction drain, and yes, it is a Romo-Vac. Okay, so vac drain, Romo-Vac, suction drain, anything will be okay. That is fine. What is the use of this? So this is basically used in post MRM. The most commonly where it is used is, it is a post MRM. Right. So this is basically used in post MRM, modified radical mastectomy. So please understand, if I ask you, will you put this inside the abdomen? The answer is no. Why? Because a negative suction is created. So if a negative suction, if you create inside the abdomen, what will happen? The intestines will come and get stuck to here, and it may cause the kind of injury to the intestine. So you don't use it in the intraperitoneally. No doubt it is used after the surgery, but is not used after the abdominal surgeries or something like that. So wherever you have operated and there is a closed cavity and there is a risk of seroma formation, there is the place where you put this Romo-Vac. Okay, so what is this condition? After mastectomy. So if I ask you which is the most common complication of mastectomy, it is seroma. So to prevent the seroma formation, what you do, you put in this drain. What is this? This is a Romo-Vac drain. Okay, so please understand this. Okay, important. Now another point is, a question was asked in a couple of years back, if accidentally this Romo-Vac drain has been removed accidentally, what will you do? The seroma formation will still continue, and if you don't kind of remove the seroma, it will be hazardous to the patient. So if at all there is an option that remove a couple of sutures and drain the seroma, that is the best option. But if at all that is not given in your options, then you will have to remove the sutures and open the wound. Okay, so please understand this. What is our purpose? Our purpose is to drain the seroma. That is why you have put in a drain. So if the drain is there, that is fine. If the drain is not there, you will have to remove the sutures and you will have to drain the seroma fluid. You will not go for percutaneous aspiration. That is not the kind of a thing for that. But if at all just removing a couple of sutures and draining the seroma is not given in the option, you will have to go for removal of the entire sutures and making the wound open. So this is what you will have to go for. Okay, so is lymphedema a complication? Well, lymphedema is not a complication of putting this drain. Lymphedema is a complication of a extensive axillary dissection. So it is not a complication of putting a drain. Lymphedema is a complication of extensive axillary lymph node dissection. So there is a difference between them. Okay, so please understand them. And just for you to understand, this is how it works. Okay, so you create a negative suction and it basically pulls the blood and the seromatous fluid out of the cavity. Okay, and as the fluid enters into this negative suction drain, the drain basically expands. Okay, so this is how it works. I hope you understand this. Okay, right. Now, what is this? Can you tell me what is this? So the above thing which I showed you, yes, it is most commonly used in the modified radical mastectomy, but it can be used at other places also. Let's say if there is you have operated a very big wound on the buttocks or the thighs or somewhere. So what will happen? If you do the operation over there, what will happen? It will kind of create a seroma. So there also you can put in a negative suction drain. Okay. So can you tell me what is this? Is it the same thing or it is something different? What is it, guys? Can you tell me? This particular thing, can you tell me, guys, what is it? Please answer. So, right? Anybody? Any thoughts on this? So, Anik, what is it? Money, Aman, Rupal, Richmond. What is it, guys? Can you guys tell me? Suction drain. Okay, it is again a suction drain. See, I deliberately showed you this. Okay, so I deliberately showed you this. Why? Because this can be asked to you. They have asked you a couple of times this, but they have not asked you this. So this is again a suction drain, and this, to be specific, this is called as a Mini-Vac. Okay, so if at all they ask you this, they will, in the options, they will give you Mini-Vac. So please understand this. This is a Mini-Vac. So this is again a negative suction drain, but it is a Mini-Vac. So what is the surgery where you use it? Simple drain. Okay, so which is the surgery where you use it? Can you guys tell me which is the surgery where you use it? So this is used in let's say you must have seen it if at all somebody underwent a thyroidectomy. So after the thyroidectomy, you put in this Mini-Vac over there. Or let's say if somebody has been operated for a breast abscess or something like that. So in these places, you prefer to put in this Mini-Vac, okay? So wherever the cavity is small and the amount of negative suction which you need is small, there you can put this Mini-Vac. Please understand this, okay? So, right. So does Mini-Vac mean that it has low capacity of collection? Yes. Mini-Vac means that it has low capacity of correction. At the same time, it also has low capacity to generate a negative pressure. So if at all you have a bigger drain, it will create more negative pressure and it will take out more fluid. So in mastectomy, you will never put in a Mini-Vac, okay? So where do you put it? As I've already told and as Nihal has already answered. So you put it in a patient after the thyroidectomy to prevent any seroma or a reactionary fluid accumulation in these places. So wherever you require less kind of a suction force and wherever you anticipate that less fluid drainage will be there, at these places you will have to go for a Mini-Vac, okay? So this is all for today, guys. I hope you liked it. So deliberately, okay, so I'll just take up a question, sir. How to differentiate between Mini-Vac and Romo-Vac on looking at the picture? You can distinguish, okay? So if I just expand it for you, I'll just try to expand it for you. It looks smaller, okay? And most of the times Mini-Vac has only one tube, okay? So it looks smaller and it has only one tubing, okay? So Jackson Pratt drain is different, okay? Yeah, I know Jackson Pratt drain रह गई, but आप सब लोगों ने देख ली होगी after the AIIMS exam. So yes, that is also important, Jackson Pratt drain. So it is basically like the bulbous thing. I'll cover it in the next time. Don't worry, I'll definitely cover it. But yes, it was asked recently in the AIIMS exam, so you must have gone through it. But I'll definitely cover it in the next session, okay? And yeah, so coming back to your topic, how to and be distinguished. So this Mini-Vac, it looks smaller, and if you just look at this Romo-Vac, it looks bigger. And another point of distinguish is you have to look at this, okay? So here the two tubings are attached, two tubings, but here there is facility to attach only one tubing. So this is how you can distinguish between them, okay? Sir, when will we use random pylolithotomy forceps? Okay, so please understand, pylolithotomy forceps, most common site of keloid and hypertrophic scar, okay? Sir, when we used, okay, just a minute, guys. So okay, so I'll take up all the questions. So Dipanshu is asking, in cholecystectomy, which suction drain to put? In cholecystectomy, you don't put in a suction drain. No, you don't put in a suction drain. You just put in a simple abdominal drain. You don't put in a suction drain. First thing, if at all you have operated on the choledocholithotomy, you have opened the common bile duct, then you will have to go for a T-tube drainage, okay? But you don't go for a suction drainage when you have done a cholecystectomy. First thing. Another thing is, sir, when will you use random pylolithotomy forceps? So please understand, pylolithotomy forceps can be used if at all there is a stone inside the pelvis and you are not able to reach that particular point, okay? So when will you use it? Depending on the surgeon. If at all the stone is depending in the dependent position, then you will have to put in this particular pylolithotomy forceps and you will have to take it out, okay? So depending on the surgeon, okay? When will you use it? Right, I mean, during the surgery, if you feel that your fingers cannot reach to those particular stone and take it out, you will take assistance of a pylolithotomy forceps, okay? If you have any specific question related to it, please do put up. I'll try to find that specific answer. But for now, what I'm trying to tell you is, if at all it is dependent position, you will have to go for a pylolithotomy forceps. Right. Now, most common site of a keloid and hypertrophic scar, that is a triangle. So basically the sternum. So it is a triangle formed between both the shoulders and the zippy sternum. So that is the most common site of a keloid or hypertrophic scar. So conditions with their surgical procedures की list करवा दो systemic की. Okay. क्या बोल रहे हो आप? Like conditions with their surgical procedures. Okay. So okay. Right. Again, if you are my plus subscriber, you can have attended my lecture on what is it? It is all the eponyms in the general surgery. I have covered all the types of the surgeries in it. So I have a couple of sessions for the YouTube reviewing. I'll try to cover it. I cannot actually guarantee, but yes, I'll definitely try to cover it. Okay. But if you told you are a plus subscriber, you could have watched the eponyms video. I have covered all the eponyms in the general surgery in 2 hours. And I have also covered the all the classification systems in the general surgery in 2 hours. Okay. So yeah, but I'll definitely try to cover. Don't worry. Right. So Anik is asking, sir, corrugated drain use. So please understand, corrugated drain is, so I have plans to cover the corrugated drain in the part 2, but I'll just discuss it with you. So what is a corrugated drain? This is how a corrugated drain. So please understand, all these drains which we have talked about, these are the closed drain. What do you understand by the closed drain? That they are not communicating with the external atmosphere. Okay, but here in the corrugated drain, what is the basic thing? It is an open drain. It is not a concealed tubing. It is just a corrugated tube. That's it. So where do you put it? You also put it for the draining of the abscess. So if there is a abscess in the subcutaneous tissue, you can put up a corrugated drain. So for example, if there is a thigh abscess, there is a big thigh abscess, and you are worried about seroma formation, then you can put in corrugated drain. But what is the drawback of this? The other drains you can keep for 5, 6, 7, 8 days till the output reduces. But because this is an open drain, you will have to remove the corrugated drain after 2 to 3 days, 2 to 3 days maximum. Why? Because if at all you keep it for more time, the Staphylococcus epidermidis, the coagulase negative Staphylococcus epidermidis, which is present on the skin, it can find its way through this corrugated drain, enter into that particular cavity, and it can cause more abscess formation. Okay, so yes, that is a basic difference. It doesn't have any concealed tubing, right? And I'll cover the image in the next session. So yes, okay, so I hope you got the answer. So thank you so much, and thank you Sushant, thank you so much for the comments. I'm really happy to see this. And right, so please follow me on Unacademy. If you're not, I'll feel really happy. And right, so I'll be having another session on instruments tomorrow evening at 4 or 5 o'clock. Okay, so tomorrow evening again we have a session on the instruments, and tomorrow I also have the session on sutures and knots. Okay, so it was scheduled for today, but due to some personal reasons I'll not be able to take it today evening, so I will be taking it tomorrow. So tomorrow from 4 to 4:30 we have a session on sutures, and from 5 to 5:30 we have a part 2 of this instruments. Okay, so I hope I can see all of you guys. Okay, so thank you so much. And yeah, if at all, if you're not following me, please follow me on Unacademy. I'll be really happy to have you as my follower, and you will get the notification of all the free classes which I take there. And if at all anybody of you want to join any of the kind of courses on the Unacademy, you can use my promo code. You will get 10% off. My promo code is dr.pawan. Okay, so thank you so much for joining with me today. It was indeed a pleasure connecting with you, and hope to see you tomorrow. All the best. Happy studying. Right, have a great day. Bye.